My name is Andrew Buzari, and I'm a primary care physician, an executive director at UHN for social medicine. And it is my privilege to be a moderator of this panel that we have slated today on housing, health, and justice. And it is incredibly timely given both the histories and the realities that we are facing in the homelessness sector, in the justice sector, and in the healthcare sector, with pressures that we have just not seen before. And I would like to start in terms of acknowledging where I am situated today on the land and the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Wendat peoples, the Haudenosaunee, and many other diverse First Nations, Inuit, and Métis people. I also want to acknowledge the great learnings from Indigenous leaders, colleagues, and friends around expanding our notions of health and how so much of this intersects today, and acknowledge the amount of work we still have to do around truth and reconciliation, especially as it pertains to healthcare. And I also want to start with the commitment in solidarity with Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact Black communities in Canada. As part of this commitment, we have to acknowledge that not all people have come to these lands as migrants and settlers. Specifically, I want to acknowledge those who've come here involuntarily as a result of the transatlantic slave trade and slavery. We have to pay tribute to the ancestors of African origin and descent in terms of situating where we are right now. I would also just like to acknowledge the time and the heaviness right now of the courage of Iranian women, mainly in Iran, in the push for self-determination as a son of the diaspora, and knowing that there are many battles and struggles for human rights and self-determination across lands, and knowing that this is impacting many of us and all of us in the work that is ahead. So it is with my real gratitude and privilege to be able to play moderator with real bona fide experts in the spaces that we have identified around housing, health, and social justice. I have been told to also ensure that folks know that closed captions button is on the bottom left side of the screen. If that is something, again, ensure that of use to be used for today's session. And I want to start by introducing Steve Kaladich, who's a person with lived experience and is living in the St. Jamestown neighborhood. Kate Matthews, Assistant Crown Attorney and Ministry of the Attorney General of Ontario and Prosecution Lead of the Toronto Downtown East Justice Center, in terms of learning more about that today. Luisa Sotomayor, who is an Associate Professor, Faculty of Environmental and Urban Change at York University, and Paul Bailey, who I have immense respect for in terms of all of the work he is doing as Executive Director of the Black Health Alliance, and I'm fortunate to work with many folks on Paul's team through the COVID pandemic, and much, again, of the work and leadership today as it pertains to housing, health, and justice. This is a group with deep expertise and experience. And I just want to, in terms of the opening, and to really make up here for time, though, to just really have this in terms of the brevity to start of how we can frame this discussion. And I appreciate where we are here is at a time that we will need immense honesty about the challenges that we are facing, and really just the need for collective action from every level of government, when right now here at the hospital, we cannot disconnect the housing crisis from the hospital capacity crisis that we are feeling, and from the public health crisis that is playing out, both with overdose deaths and a lot of pain and suffering in communities that we are speaking to, that has really been a disproportionate impact for far too long. And as I've been leaving the hospital and entering the last few days, there are more people having to sleep intense with nowhere else to go. We are seeing this across the country, across the city, across the province. And really, I think this is where the discussion today to frame how these are issues that are intersecting from social justice to health and housing, but really wanting to tap into the deep expertise of the panel around how we can move on some of these solutions. But really to start, I just want to be able to start with Steve in terms of really with every panelist to sketch out a little bit in terms of the key challenges and issues that we're seeing in Toronto regarding housing, health, and justice, knowing that we're coming from some different vantage points, but so much of this connecting. But Steve, if it's okay to start with you around what you are seeing, what challenge issues you want to speak to start today.
There are no spaces for housing, for the kind of housing that needs to happen. There is no social housing or supportive housing that is not on a long waiting list. And it's all over the GTA, particularly downtown. I'm not sure what the solution to that is, but it's we've got like 10,000 homeless people in Toronto. Homelessness means a lot of different things, but they're some kind of homeless, all 10,000.
Right. And thank you to that, Steve. And in terms of really describing, I think, painting again how there are no places for people to go. And I think the latest number is again around nearing 10,000, if not more. Um, and do you want to describe a little bit in terms of what you're seeing in your neighborhood, or maybe some of the other challenges as well that you've described around mental health access and other areas as well, if you want to sort of have a chance to expand on that? But again, I think that's a very solemn reminder of the stark realities for people right now.
Well, I could show you stuff out my window, which is always interesting. Uh, Sherburne and Dundas is where I'm at, and the challenges are essentially that the drug addiction and the poverty and the homelessness and the human trafficking is just ongoing, and nothing with respect to that is being changed. Uh, I don't know how you change it at this point. Uh, our community cops have a pretty decent relationship with the neighborhood, but at the same time, you can't arrest everybody. And, you know, everybody spends like a night in the drunk tank, so to speak, uh, released the next day and free to do whatever they want. The big problem with Sherburne and Dundas is that it's a destination for drugs and human trafficking. So the lovely combination of drug trafficking and human trafficking. And that's not going away. It's very ingrained. Even as people die, as they often do in this neighborhood, they're just replaced quite quickly by a new lieutenant, so to speak.
Yeah. Steve, I appreciate the honesty and that picture of showing what is happening at Sherbourne and Dundas in an area that some of us know sadly too well. Kate, I think I might want to come to you next, given I think Steve's point again around policing and the justice system and the great work that you are involved in around potentially some reforms in the justice system or other aspects, but really to you again of some of the challenges and issues that you're facing from your vantage point.
Yes, thanks very much for having me on this panel. What Steve has just described is what I see every day in my work. And so just to give you a little more context about my work, I am an assistant crown attorney. I have basically spent my professional life, which is over 20 years now, working in the downtown Toronto Crown's office, and more specifically assigned to the College Park Courthouse. College Park Courthouse, there are various neighborhoods of the city that feed into that, but a big portion of the cases that come into College Park come from Steve's neighborhood. And what I have seen over my 20 years there, and I should say I'm a frontline prosecutor, so I'm in the courthouse every day. What we see in the downtown jurisdictions is a high number of people who cycle through the criminal justice system, who have significant challenges with substance use, mental health, precarious housing, developmental disabilities, physical health, all of these, and in fact, for most people, I would say they have multiple of these challenges at once. They typically are charged with low to moderate level offenses, and they cycle in and out frequently. When I talk about low level offenses, it's things like shoplifts, commercial break and enters, some minor assaults and threats. What we call administration of justice offenses are really prevalent amongst that population. And administration of justice offenses are things like failing to comply with court orders, failing to appear in court. There are many reasons why people come into contact with the criminal justice system. But in my experience, a lot of what I'm seeing in this population is driven by those underlying factors. I can just give you some very general examples of how that can happen. So it could be the very fact that somebody has no secure housing leads them into contact with the criminal justice system. For example, if you have nowhere to go and you are now loitering at the local hotel or at the Tim Hortons or wherever, and your behavior is causing some difficulties there, chances are you're going to come into contact with the criminal justice system. If you have nowhere to go and you decide, you're going to make use of an empty room that you're aware of, chances are you're going to come into contact with the criminal justice system. Sometimes, of course, it's the state of mind that is caused by use of a substance or the mental health challenges that causes them to act in a way that is going to bring them in contact with the criminal justice system. And then just finally, a very common occurrence in terms of those administration of justice offenses is that if you have nowhere to live, typically a lot of people get their possessions stolen or they're lost. They lose all of their court documents. They lose their reminder slips. They don't know when they're supposed to go to court. They don't know when they're supposed to be reporting to their probation officer or to other supports. And then ultimately they end up charged with breaching their court orders. So I see an awful lot of that. We see people who have, if they are incarcerated, subsequently when they're released, if they have nowhere to go, they have especially if there's no supportive housing, there's very little opportunity for people to try and stabilize and to try and avoid the cycle. And so those, very generally, very broadly, those are the challenges that we see in the criminal justice system in Toronto that arise from these kind of concurrent challenges of housing, health, and justice.
Yeah, thank you so much, Kate. I mean, I think, Lana Fredo, who I know and who has shaped a lot of my own thinking on this issue, has sort of described the prison system as the de facto housing system, which I think you're really speaking to, and the inequities that are in place there. And I think in terms of wanting to continue to, see how this is all intersecting with both the barriers, and I think again from the justice aspect, Kate, which you spoke to so clearly. Luisa, I was hoping to come to you next in terms of trying to better and also further sketch out where we're seeing a lot of this come through in terms of the challenges for people with disabilities and affordability, and a lot of your own research and work in this area in terms of what you're seeing from your vantage point, as we've heard from Steve and Kate around this intersection of the justice system and housing, and now sort of to your vantage point, please.
Thank you so much, Andrew, and thanks to the City of Toronto for organizing this panel. I really appreciate the dimensions on social justice and health, because we've let the discourse on real estate and development define much of the housing affordability crisis. And what I would like to start with is by emphasizing that the challenges of the current housing crisis are not equal for everyone. And just building on what Steve and Kate have said, the challenges are not experienced equally. We know that people with disabilities, people with non-legal status or precarious legal status, low-income populations, non-white low-income populations, but also low-income students are experiencing the challenges the most, despite the fact that everyone currently is feeling the crisis. And this is because housing is not just like the housing crisis is not just a housing crisis. It's also a crisis of other things that come attached with housing. The concept of housing affordability is a relational concept that talks about the material and social relations and the space where people are embedded in. So that speaks to the ability or inability to afford other essential needs like food, transportation, childcare expenses. So one thing I would like to emphasize is that this is a relational concept. The housing crisis and the affordability crisis is a relational concept that depends on on good jobs or bad jobs and all the conditions to be able to afford quality housing, in addition to the characteristics of housing itself. In the case of research I've conducted recently with colleagues at the University of Toronto, OCAD University, and Toronto Metropolitan University, looking at the barriers of students in accessing affordable housing in the city of Toronto, we've found some very clear relationships between health and their health outcomes and housing access and affordability and quality of housing. So we found, for example, that while some students are spending way more than they should, that definitely compromises their ability to afford nutritious food and to access all the different pieces that would, like, transport to get to school, right? Like we've seen students that are limited their academic engagement because they don't want to spend as much in transit because the housing is expensive. So that is one angle to it. Another one is the students that just can't afford housing, and then they access very poor quality housing units in informal rooming houses, and that affects their health directly because there's no pest control, they don't have access to common areas. So we saw a lot of units in informal rooming houses with no access to kitchens, with very precarious, just quality. So we see that relationship. And so those are like examples in the case of students. And then I would like to add two quick points. One challenge for the City of Toronto currently that we don't talk enough about is the ability to protect the good quality housing and the naturally affordable housing that we already have in the city. Research by the Wellesley Institute has pointed out, and by Steve Pomeroy have pointed out, that for every one unit that is created with government funding, 15 units are being lost to renovictions, to short-term rentals, and to other processes of gentrification in the city. So the lack of protection for existing affordable forms of housing that are the ones that people with disability, mental health issues rely on, are the difference between life and death and being on the streets for people who are the most vulnerable. And yeah, I'm on my 5 minute. Right, thank you.
No, well, thank you so much, Luis. And we'll have time to get back to you. I know that there's just such a depth of research that you and your team have on this. And I just think, really as you mentioned this about being life and death, it is not hyperbole. We're seeing this with the data in healthcare as well. We've long known and we have seen homelessness as a terminal condition when the life expectancy remains less than half at 40 to 42 years of age versus 80 to 82 of the general population. And I, again, want to highlight we have a lot of evidence and data around how cruel homelessness has also been throughout the pandemic, which was of no surprise for those of us in this work where, again, when the conversation is about life and death, that people who are surviving homelessness were 5 times more likely to die of COVID during the pandemic and 20 times more likely to be admitted to hospital. So we have seen a lot of great work and researchers around the city and really, again, the leadership happening in communities to address the disproportionate impact around homelessness as a real cruel lever and tool of systemic discrimination. We see the street needs reports of close to 50 to 60% of people surviving homelessness being from Black and Indigenous and refugee newcomer communities. Paul, I know your team for a long time has been wanting to address the impacts and the disproportionate impacts of housing and homelessness in Black communities, in neighborhoods, in poverty. What are you seeing and describing now? Again, you've long spoken to the challenges and issues that are disproportionately impacting various communities. And I just wanted a chance to go to you now in terms of where you're seeing this at ground zero.
Will do. First, thank you, Andrew, for moderating today, but for the work that you do. Honestly, your work inspires, I think, a lot of the things that we're doing here, and thank you to Housing Secretariat for organizing the panel. I think it's important in setting the context to understand that housing in and of itself, whether we're talking about folks who are underhoused or homeless, affordable housing, RGI housing, market like it's really complex and even more complex when we layer on health and justice into the conversation. But for me, I think the thing that I want to dial into is that the burden of challenges as it relates to health and let's say housing, social determinants of health isn't equally spread across the city. If you were to map some of the social determinants of health onto the city and chronic disease as well, you would see that many of these factors, things like low and very low income, diabetes, hypertension, food insecurity, income insecurity, all of that maps on and gets concentrated in the northwest and the northeast of the city. And from work from folks in public health and folks in academia, we know that what makes up our health isn't simply can we get access to healthcare. It is the social determinants of health, social and structural determinants of health that make that up. And so I think it's also important to note that where we see the highest concentration of Black populations in the city is as well in the northwest and northeast. And so for me, looking at some of the data, we know that Black people are among those that have the highest health inequities as it relates to things like core housing need, with 12.8% of Black Torontonians living in inadequate housing. We know that upwards of 30% of Black children and Black families are living in food insecure households versus 12% of white families. And then we know at the peak of the pandemic, 21% of those COVID cases were in the Black community or among the Black population, regardless, that we make up only 9% of the population. So for me, what I'm seeing is, a massive situation that's getting worse. It's stratified along geography. It's straddled along race. And I think I'd be remiss if I didn't mention if I dial into Toronto community housing, specifically in, my parts of the city, I have at Torbolton Road, Toronto community housing townhouses that have been boarded up for 15 years. 15 years every day, you drive past it or you take the bus past it, and nothing's being done. Folks might know the story of Firgrove or Connections. The land is sitting barren now. Perhaps no development partners available to support in that work, and most recently the case of Swansea. So when I think about, particularly what Louisa was speaking to, the preserving the housing that we have, the conditions that people are living in right now, with literally ceilings falling on their head, for me, it's critical that we understand that these, again, inequities are geographic, that these inequities are racialized, and that it requires us to really think through, what a targeted and specific approach for those geographies and those populations, including Black populations, would be. I'll leave it there.
Yeah, I mean, I know that we had a 5-minute delay with technology, but it's been so crisp on timing. So I think that this is, again, the panelist has been superb in trying to address both the issues around time, but also the urgency. And I do have to say, Paul, I mean, we've had this conversation. I think you've spoken to it so brilliantly around postal codes really being proxy for pathologies of poverty and for systemic discrimination. And it's not about geography, but it really is about those histories and those structural factors. And I do want to just, a little bit in terms of tying this together in some of the really superb points raised, because, I think a lot of us are feeling the weight of what's been happening now in ways that we may not have anticipated, at various parts of the pandemic. I think there was a sense of adrenaline for all of us on the panel and the work that was happening around this exposure and potential greater understanding of the public of what is happening and how cruel homelessness is. And we are now here, squarely in 2022, near the end of the year, coming into the winter. And this is a massive challenge, if not with widening disparities that we were just hoping and willing would not be the case. And I think one aspect, again, I think that especially Louisa and Paul have spoken to around the data and the research. I think it's something that we in the healthcare system continue to do a very poor job of, is actually collecting the data around people surviving homelessness, and let alone the amount of action that continues to need to take place. And so I want to be able to go to some place around where, again, given the deep expertise of the panel, move to some of the actual solutions. Because again, I think, when Paul spoke to the peak of the pandemic and how disproportionate the impact was on Black populations, Black communities, and other communities of color, there was real resistance for us to collect that data in the first place. And so it was one about getting the data collected around health equity and race-based data. And a lot of leaders like Paul and many others in academia and community to say, we need race-based data. The pushback was, we have a universal health system. We don't need that data. And that was categorically false and cruel when you look at the disproportionate impact that Paul has spoken to, but also the fact that we could see real success. And I don't think it's actually talked about enough in how communities willed the curve around COVID prevalence in a totally different direction, whether it was increasing the uptake of vaccines and solutions that were driven in communities, as well as really when it goes back, I think, to the way Louisa has framed life and death. There were many, many lives saved through collective efforts for people in this room today throughout. So I want to acknowledge that and want to start to bring this to the sort of solutions and recommendation aspect of where we're at in terms of trying to find solutions and the recommendations from each of you on some of the challenges that you've described. And Steve, I'm going to come back to you as you started this off with a very solemn and honest picture of what's happening around you and what you've experienced. And I know that you've also really been pushing on, we need to see action and we need to see solutions. What are some of the things that you want to see start to be taken up by people in this room and obviously across the city and country today?
Today, wow, there's a lot here.
Go for it.
Okay. I live right beside a place called Street Health. I'm in the building next door, and the building on the other side of me is TCHC owned. There's an older folks place, and there is a regular folks place, and it is just the worst as far as violence. I've been subjected to violence, and I'm a big guy, and I'm 6'1", 200. And when that kind of stuff happens, it's no one from the actual neighborhood. It's just because it's a destination point for folks from all over the GTA to come to get drugs and partners, so to speak. And as far as a solution, what we need to do, at least at Sherburne and Dundas and in the downtown East End here, is decentralize things, because the entire neighborhood here is just jam packed with social services. And when that happens, you get a whole lot of homeless people and gatherings and gang stuff. And I live in a red neighborhood with respect to gang color. And that's prevalent. A lot of that comes from Scarborough. And we're not really sure what to do. You can't jam this much social services into one little community. It's really kind of an eyesore and a big weight on the entire neighborhood of South Cabbagetown and Cabbagetown itself.
Yeah, thank you, Steve. Is that just want to make sure as well, as I've been experiencing technical difficulty, so I don't want to cut you in any way short. But is that where you were in the statement? I can see you blinking now, which is good because I get a lot of frozen screens on my end. So I just want to make sure we didn't lose you. But thank you for that. And Steve, I know we've had a chance to connect on the neighborhood, and I think in terms of my own family's history in St. Jamestown, not far again from where you were on Rose Avenue. We see a lot of folks come in from many different places. But I think the thing for me that's always been really clear about that postal code is that there is a lot of strength and resiliency. And I wish, that we would stop putting all of the funding into policing, but actually more opportunities for people that are there in terms of the community, and seeing more of this work, as you've spoken to, in terms of the weight that people have to feel actually be funded and resources. I think in terms of where that discussion has been, and that we've seen, we're not going to police people out of poverty in these neighborhoods. And I think for far too long, we have not seen that upstream investment for people and families like myself, which were very fortunate in how things had kind of played out, but knowing that there are still many folks who had a bad hand that was only furthered by police violence and different punishment that Kate has, spoken to in such ways. Or how do we start to see the shift in the court system, the justice system, policing? So Kate, to you, really on what are some of the solutions piece. Like you've described the challenges and what we have is this para-housing system and the prison system. Where are you hopeful on some of the things? I know you've got some pilots and work underway, but where are you hopeful both on what you're working on, and feel free to speak to it, writ large on what you'd like to see as far as the changes and solutions.
So when Dr. Buzari introduced me at the start, he mentioned that I was the prosecution lead for something that's called the Toronto Downtown East Justice Centre. Justice centres are new to Ontario, but they are a result of the fact that Ontario recognized that we have to innovate how justice is being delivered to some of our most marginalized and vulnerable communities. That recognition led to a process of needs assessments, community needs assessments in particular, and then to the launch of 4 pilot justice centres across the province, 2 of which are in Toronto, and 1 of which I lead, the Toronto Downtown East. It's really important to understand that in the development of these pilots, we were really interested in making sure we were actually reflective of the needs of communities, which is why those community needs assessments were so important. Also, in the design of these pilot justice centres, we took a participatory design approach. And so we struck steering committees that were made up of not just justice system participants and actors, but more broadly community members, organizations that work in the community and provide service to the community. And that was important because of a belief that in order for this actually to be as effective as we would like it to be, it shouldn't be driven sort of top down necessarily from the justice system, but also really so we all have a broad understanding of what the needs are and how we might be able to address it. So the idea of justice centers is that we take justice out of the traditional courthouse model and we place it in the communities where the need exists. The goal, of course, is to increase access to justice for these marginalized communities, as well, I would say, for the community at large, so they feel a part of what's happening in terms of justice. We want to, of course, target and address some of those underlying factors that are leading people to be involved in the criminal justice system, and try and somewhat stabilize the lives of people who are involved in the justice system, and also improve the lives of the community. So those are the big broad goals. How are we getting there? I feel very fortunate to be asked to be involved in this pilot project in the Downtown East, because as I said, I've seen this cycle for many, many years, and it is exciting to see what is possible when we take a different approach. So in the Downtown East Justice Centre, right now, we launched during COVID. So I should say we launched this in late spring of 2021. We were fully into COVID at that point, and the courts were operating largely remotely. And so we adopted a hybrid in-person and remote approach. We have been very fortunate to partner with many agencies within the community and within the justice system. So we are working primarily, our community partners are Sound Times, Community Support Services. Sorry, I said that wrong. Sound Times Support Services. Dr. Buzari earlier referenced Lana Fredo. She's the executive director of that organization. They are a survivor-led organization. They have a very good understanding of the needs of this community that are interacting with me. They provide a lot of support to people who are coming in. They also provide on-the-ground, in-house services, for example, some of their smart recovery programs to address addiction, some anger management programs, lots of social support programs, which are also important. They also provide the means to connect to court. So the court is operating virtually, but the population who participate in the Justice Center have somewhere to go to access the technology so they can attend court, which is very, very difficult for many people who don't have a computer, don't have a safe, secure place to connect to court, don't have a phone necessarily. That alone helps us reduce those administration of justice offenses that we would typically see. We also work with the Inner City Health Associates, who also, they are physicians, healthcare professionals who work with homeless populations, also very, very well familiar with the needs of this community. They have a clinic that operates out of Sound Times. So people who come to the Justice Center can access primary health care, psychiatric services, addictions medicine specialists, all again in one site. Our other major community partner is Surrey Place. Surrey Place works with people with developmental disabilities, including people who have autism spectrum. That has been a very important piece for us because my experience in the justice system traditionally is that we have mental health diversion programs, but we didn't have something specific for people with developmental disabilities. And then they would sometimes just kind of get streamed into those programs, which are not necessarily providing the services that are appropriate to them. So we're very fortunate to work with those three partners primarily. We also work with the Toronto Police. The 51 Division is our main Toronto Police partner. They work in that community as well, and they've been very supportive of this project. So the idea is that people who come to the Justice Center, their criminal charges, it is a court model. They go through a court process just as they normally would, but we are really trying to take an approach where they can choose to, it is purely voluntarily, people can choose to participate. They work on developing a plan that addresses some of their needs, and it's very broad. Some people really need to work on getting their ID replaced, which is a crucial first step in getting housing or getting access to healthcare. They often need income support. Almost overwhelmingly, people will tell us that they need housing support. And so they develop plans where they are supported in trying to attain those goals. And the idea is that they can show, it's a way also of holding them accountable, because it is also important to hold people accountable for the behavior that harms community. But in this way, their involvement with taking steps to improve and stabilize their lives is the accountability piece. And so that's really what we're looking to do. Some people will plead guilty. Some people will have their charges diverted. There's various things that can happen with respect to the outcome of the criminal charge, but that is the goal of the Justice Centers.
Thank you so much, Kate. And I think these are a terrific initiative. And I'm obviously biased as a physician who's heading to that clinic this afternoon to work in Sound Times. And, I don't think there's one clinic that I don't continue to learn from Lana and from everyone else working at Sound Times. If folks don't know about the organization, I think they do incredible work day in, day out. And there's not a clinic where I don't get told by Lana about what I could be doing better. And she's always right. So it's always something where we continue on that learning. And it's great to see those partnerships that you've spoken to. I think, as you pointed this out, Kate, again, a lot of this is around people not having housing, the work from folks at Sound Times, at different partnership agencies, at Inner City Health, everyone advocating, pushing, clawing for housing for patients and clients throughout the system. And as we're seeing this happen right now, I have to be very candid. We are now having dozens of people across the city and downtown hospitals coming to emergency departments while we have immense emergency department pressures, given the backlogs, given what's happening in pediatric hospitals, because they have nowhere else to go to get warmth. I mean, this is a fundamental failure on housing and health. We're talking about housing, health, and justice. And thank you, Kate, for how this really intersects. And Luisa, I want to come to you because as we're having this picture playing out either in our hospitals, community clinics, the justice system, what Steve is describing at various intersections throughout the city. We are also seeing the proposal of Bill 23. This is a moment of legislative importance. And much of it seems to be really driven around housing supply, for those of us looking at it in terms of the outside around Bill 23. And no one, though, can deny this is looking to have a serious impact for our patients, communities, and clients when we are talking about affordability and access to housing. So not to only channel you on Bill 23, because I know you do, and your team does a lot of research on the solutions, not just the descriptions of what we're facing, but really want to see, your take on Bill 23, what that might mean, and also any other solutions that you think we have to be fighting towards.
Thank you, Andrew. Yeah, I've been doing some work with my colleague, Stefan Kipfer at York University, precisely on analyzing what building more homes faster may mean, particularly for people for whose the housing question is truly an existential question. So I would say that in general, there's nothing wrong with calls for more housing. After all, the housing crisis means that many people have social needs, housing social needs that go unmet today. So we could assume that increasing the housing supply might be a way to meet a wide-ranging and growing demand for well-built, accessible shelter, right? In practice, however, we know that calls to boost housing supply may or may not meet the social needs, right? So when we think about adding beds to the emergency shelter system, building supportive housing units, repairing public housing, as Paul mentioned, which is sorely needed, turning greenfields into low-density subdivisions. These are all very different types of policy approaches and outcomes, right? Building luxury condominiums, right? So while each of these solutions, each of these types of housing supply may meet some social needs, the social needs that they will meet are very different. So I would say that the key question is what type of needs will be met and what type of housing supply is being called for. So in the current Bill 23, what we find problematic is that what is supply, that the call for supply is unqualified, is not targeted to meet the specific needs that we've discussed today. And in general, it means ownership housing, right? While this may seem like an innovative new call for housing, it's also important to remember that this is by no means a new initiative, a new idea. The founding of Canada and the history of our country as a settler state has been built on taking land, turning it into real estate, and the homeownership approach has been subsidized through provision of infrastructure, like highway infrastructure, low interest rates, and so on. So the history of housing provision in our city and our province has been the history of the promotion of ownership housing, except for two specific periods in our time, the 60s, where we saw the expansion of public housing, and then the 70s, where this was complemented with cooperatives and other types of nonprofit housing. So a call for new homeownership is not new, but then the invitation is really to question who's going to benefit from it when we have the pressures from the financiers, the investors, what we heard the other day being called, which I find outrageous, like the artisanal landlords, like the small-scale homeowners like extracting rents and taking advantage of the costs. So will this boost in supply be destined to meet social needs, the social needs that we are talking about? It may or may not, but I would be very cautious because this is just more of the same that we've seen throughout, and more of the same which has brought the housing costs so high. Yeah, I would just finalize that a lot of the discourse that we've heard in terms of planning being the culprit and zoning being the culprit and let the markets work. The experience from cities in the US is that as soon as you upzone, the market responds by producing a whole lot of very expensive housing, right? Like there is a process of optimization of these markets where prices are going to be high. Whether you have, like if you upzone, prices are going to be high. And that perhaps more of a critical take on the impact to the greenbelt and our very precious environmental resources, and the careful regional planning and the history of regional planning should be really taken into consideration when talking about building homes faster. And again, like this shouldn't be an unqualified call, right? Like it should really target social needs. Yeah.
Thank you, Luisa. I mean, I think that, obviously deep knowledge on and study from your team on Bill 23, and appreciate the analysis, both from our histories of a settler state and the move towards real estate in terms of the commodification away from it being housing as a human right, which we have failed on cruelly. And I'm going to take some liberties as moderator and say maybe the upshot is that Bill 23 could potentially be catastrophic, if that is all right. I mean, I think that is the challenge and the weight that many of us are feeling. And I know there's not just, your team has done superb work and you're writing on Bill 23, but I know many others have put forward very serious concerns, and that the impact of Bill 23, yes, around, as we've talked about today, not just around housing affordability, but this really being both a public health and justice issue that has very serious roots in systemic racism and discrimination. So I think the fight Luisa, in terms of your point, is to be constant and that we are, again, not able to disconnect what's happening in our healthcare system from what might be pending in the housing system around a supply aspect that does not put health equity and the human right to housing first. So in not wanting, taking liberties and moderate, but not to be too down on what's happening. But again, always, I think all of us have promised in this panel to be honest and unwavering in what we are seeing and what we believe the solutions have to be in speaking to power and those who can influence the decisions being made. Paul, I want to come to you because I know that, again, you have spoken previously, but have done the work pre-pandemic around the social determinants of health, which you've described a little bit earlier in your opening remarks, but happy to get into how you see potentially the ways to address these social determinants of health that have long been discussed, both pre-pandemic, during it, and what we're facing right now. And I think, the point that was raised about accountability and some of these pieces, again, of what are the solutions and how do we in this work have to be held accountable, and our governments across all levels, I know you've spoken to, have to be accountable if they are serious about improving the health of Black lives, of all communities, of refugees and newcomers. And so really to you in terms of what you've been doing, both from your thinking and the action on the social determinants of health.
Yeah, thank you, Andrew. I think, so the stats in the context that I shared earlier, around racialized health disparities, I think, our work at the Black Health Alliance is directly focused on Black communities, and I would be remiss if I didn't, name clearly like systemic anti-Black racism as a key factor in all of these determinants, and perhaps a determinant in and of itself. You can't address income without addressing systemic anti-Black racism in the economy and in employment. You can't address housing needs for Black folks without talking about and addressing anti-Black racism in the context of housing provision, across the board. I would say in Toronto, we don't have a good understanding of what Black people's experiences is in like in the range of housing types, so whether that be RGI housing, affordable housing, market housing, etc. There are some indications around racism in market housing. Folks might see some CBC articles or stories on those things, but by and large, we don't understand what's happening with Black folks in RGI housing or affordable housing, etc. So for me, the call for the collection, utilization, and governance of sociodemographic data that helps us understand the size and scale of the problem is critical and important, not only for accountability, as you mentioned, uh, but for the practical pieces of doing the work. You don't know whether or not what's not measured, basically in my mind doesn't exist, on that piece. I would say as well, there's a piece here around uh, I think the intentional disinvestment of in communities in particular parts of the city. So when I speak to the housing at Tor Bolton, sitting there vacant, boarded up for 15 years, for me, those are the indications of the disinvestment. Things like foreclosure, et cetera, the lack of dollars for upkeep of the housing that literally pushes people out. And so I think it's important that we think clearly about the level and scale of investment that's needed uh, to address those health inequities. This is not an equal or a zero sum conversation. It's about what investments do we need in order to keep our city and the people in our city safe, well, and housed. And then the last thing I think is, there's a number of folks that are doing work. I would name folks like Manala Roberts and Tashini Harrison at the Confronting Anti-Black Racism Unit, doing some policy work in this space. I would name, we've had conversations with the Housing Secretariat too around the collection of that sociodemographic data and the setting of targets that helps us ensure that when we're thinking about the responses that are needed, we're doing so with a clear eyes in terms of what's needed for Black communities and setting targets or a focus, if you will, on that population and resolving that issue at scale. I think the last thing I'd say on the solution side is, and this is part of the work that I learned through you, is Black communities not only know what they need, they have the capacity to lead the work, and they're actually best placed to lead the work. So, when it comes to um, the issue of housing and it relates to health, I think the issue is big and requires us pushing on policy and pushing on folks to be accountable and set targets, etc. And those that level of scale, if you will. But I also think that we need to see the kind of investment and partnership with the housing secretary, with Toronto Community Housing, for example, with developers that allow for us to lead that work ourselves. And I know I said that was the last thing, but I actually have one last thing. So this was what I was going to write my major paper on at York, maybe one day. It is the way that we have very few opportunities in the city of Toronto proper to really think about like large scalable opportunities to address health inequities and social determinants of health, etc. And so one of these things is revitalizations. But the way that we approach these things often is obviously market driven first. We do things like master planning first, and things like social development. How do we ensure that this massive investment performs for the systemic inequities, the poverty, the health inequities that are facing these communities? Those things are second. And part of my point here is in order to really ensure that the investment that we're already putting into place through redevelopments, whether that would have been Regent Park or Lawrence Heights, etc., requires us to make sure that we're doing that social development planning upfront, doing it with a lens that recognizes anti-Black race, focuses on Black communities, and ensures that this massive amount of investment performs for the social development goals that the communities identify upfront at the point where we're doing those master plans. Because if we wait, you lose most of the opportunity to actually do that. So, bit of planning nerd there. I'll throw it back to you, Andrew.
No, thank you, Paul. I mean, I think that is brilliant. Whether you write it at York University or not, I think it has, major impact in what you are continuing to do and live and lead, Paul. So huge gratitude on that. And I think, really also, this has been the most superb panel. Everyone, it's an issue of where, how are you going to make it all on time with all that's here? And we've got both a little bit of time on this, and the panel has always pushed me to say, we really want to push into solutions. So I was thinking of, do we go back around on a rapid fire now round? You've now got, one thing that can be done is where we may go, given that, I'm sure the host will tell us we can't do a live Q&A with the audience, though I'm sure this panel would love that and would excel at it. So I'm going to see if we can go back around, but just a little bit in terms of, I think the points, Paul, that you've spoken to, and I think in trying to build this thread between housing, health, and justice that I think all of you have spoken to so brilliantly, is, I think, fundamentally about where people are really hungry for action and the solutions. And I think the analysis has been here, continues to be in place, which is super important. And Paul, I hear you on this aspect around data, because I think the investment there, in terms of the leadership to have this happen, what are we going to have to see in place to continue the collection of race-based data and health equity-based data when we're already seeing some resistance in the healthcare system to continue to do this, in the fact that, again, that it may not be comfortable for some of us in healthcare to talk about the R word or systemic racism. And to your point again, how these issues and real frames of social development or social equity are here at the outset. And I just have to be honest, I think there are real challenges, even both collecting that data, but then seeing the action. So I'm not going to go back in any order, but again, if you've already felt like you've spoken your piece to the audience or to powers that be on what the solutions are. If you've had something, I know Luis has been like itching down, writing down some more solutions that are there. So not to single you out, but if there's other actions that, given that whichever or all levels of government, that we have to provide both this critique and a possibility for constructive action, I throw it to anyone who wants to step in, and I'll try to moderate of who jumps in after Luisa.
Sure, I'll start. So just building on some of the points that were made before. So first of all, I think Paul is absolutely right. We are not defending enough public housing. We're not defending enough nonprofit forms of housing, which should be quality housing. These are the forms of housing that meet a lot of social needs. So the same, a lot of the discussion on the housing affordability crisis is not about new units. So we have to understand what the social needs associated with the housing problems are. And some of those problems are indeed, as Paul has eloquently expressed, about protecting, defending, investing in the public housing, the commodified housing that we actually have. Now that we know we can't expand it due to the current policy climate. Secondly, this was also mentioned before, track the loss of private rentals, low cost rentals that are already existing, that exist already, and that are being lost to renovictions, but also to the massive acquisitions of large investors who are buying them, renovating and increasing cost. So we need to have, as Paul said, better data on a number of things. I would add that it's important to track how apartment buildings are being transformed and what's happening with rents, with rents that used to be affordable and now prices are being increased due to financialization and commoditization processes. Something we didn't discuss is that when the markets are really tight, people who are experiencing housing as an existential crisis, like people with a disability, people who have experienced an involvement with the justice system, they tend to be congregated and segregated in different forms of housing because that's the cheapest to do. And when that happens, they lose their capacity to lead autonomous lives, to secure a job, to be healthy. So something that we haven't discussed enough and that we should be talking more is the issue of segregation and concentration. So we're seeing back initiatives where a lot of people with disability, particularly developmental disability, are grouped together. So we need to pay attention to that. And what else? Oh, and finally, some of the solutions and most promising solutions are in the way of the land trusts. We have 2 land trusts currently in the city, and the support that the land trust needs is actually in the acquisitions, right? Like how to access and secure more buildings that can be turned into long-term affordability solutions for a lot of people who really require them. So I think there are fantastic initiatives, Parkdale, Kensington Market. And so how do we support those initiatives that are the commodified and that, yeah, like are also promising in terms of providing affordability and meeting social needs.
I promised I would keep it open.
I'll go.
Go ahead, Steve.
I think we need serious governmental change. And if I was to compare what I'm talking about to other governments and countries, I would say Denmark, Sweden, Norway, and Finland. I don't know if you're familiar with their systems, but they are socialist and there is free post-secondary education, universal health care, and there's little or no homelessness. And yeah, I can't myself or this panel change the way our government is looking at things, which is sort of ignoring a lot of things. And it's got to change, like big change tomorrow.
Yeah, and just building off what Steve is saying, I think for me, and there are some technical solutions to this, but then there's also, I think, a more personal, interpersonal solution that we need to talk about. So I think from my work, both in the healthcare space and in the community space, I realize that there is we in the space will talk about housing as a human right and things of that nature, and but I think we're operating with a fundamental belief that and with I think a clarity that we can actually see these folks as humanity, if that makes sense. I think, unfortunately, a lot of the folks who are in power and who are doing this work don't have lived experience, don't have a frontline view for what some of this looks like. That doesn't mean that we shouldn't hold them accountable. I think just fundamentally, some of these folks do not see the folks facing these issues as human, and so I feel like unless we are prepared to name that issue, the racism and the systemic factors that kind of play into how folks view these things and take action, we're not having a real conversation. We're living in a city where the city council wants to hold property tax below the rate of inflation or at inflation, etc. And I think we have to have a real conversation of what that means to, as you said earlier, Andrew, what it means to invest $1 billion+ in the police every single year without really thinking about, the constructive ways that we can invest in some of those upstream things, particularly in the, in my mind, some of the communities that we're speaking to. And I think until we address that mental model that folks have, the lack of humanity that folks have, making the serious and urgent decisions to make those investments, I think, is going to be difficult. So, that's one. I want to share one more. And this comes from Dr. Kofi Hope. He gave the example of the massive mobilization of dollars, etc., not at the police, but at the downtown waterfront. And posited the idea that in order to address these, what are large, multi-layered, complex problems related to people's health and housing, you need the kind of multi-sectoral action, multi-level government action to support communities with the actions that they think will help to resolve the situations, whether it be fixing schools, whether it be, ensuring that people have the food that they need to secure a positive development for their children in their early childhood, whether it be access to the kind of, healthcare and allied health services that we know, is sorely lacking in very particular parts of the city. So I think, mental model, and, I think we need those large multi-sector partners to come to the table with a lens that's appreciating the humanity of folks. I'll leave it there.
Thank you, Paul. I mean, that's so powerful about the human condition piece, which I think we can loop back to on this. And Kate, I'm going to come to you. I promised you said you could go ahead, but there's actually a question in the audience for you as well. I think you've seen in the chat, but I don't want to take your opportunity also away from if you want to speak to anything else around other actions or solutions, but just to, frame the question for the audience around real interest in what you described in terms of the Justice Center model. Is it happening in other jurisdictions? And if it has, how has that helped with some of the intersections that we're all here today about housing, health, and justice?
Okay, so thank you very much for that question. So as I think I said earlier, this is new in Ontario. And so of our 4 pilot sites, we've got 3 that are up and running just for about a year and a half to 2 years. We're going to be we're going to be doing evaluations of those, so we'll have a better answer for you about how ours are doing. But I can tell you that justice centers exist all over the world. There are over 70 communities that I'm aware of that have justice centers, and in places as disparate as Australia, the US, all over the place. What evaluations of those justice centers have shown is that they demonstrate that there are reduced recidivism rates. There is an improved sense of public safety and community well-being. There's a reduction in the over-reliance and incarceration, and a general increase in the confidence and trust in the justice system. Each of these will have a different focus. So, as I said, we designed in Ontario based on community needs assessments. So in the Downtown East, we're really focusing on these issues of housing, health, and justice. In other communities, they're going to be having different focuses depending on the needs of the community. For example, if they're, some of them are youth-centered and they're going to focus on education or family supports, or and housing will play it. Like all of these can intersect in different ways. But I would say that what we're trying to do here is based on some proven models that we've seen around the world.
Terrific, Kate. And, looking forward to the evaluations. And I know that's a lot of active work underway and active work happening. I am going to try to get us through some of the questions now, knowing again, the panel was so superb to address my technological challenges that where we have some time now for the questions as well, but want to also respect people's time in going into the next session. I wanted one question that's come through from the audience, and I think we see this now every day. I mean, the report this morning is that rents have gone up to $2,500 or more for a 1-bedroom in Toronto, over $3,300 for a 2-bedroom. And the reality is, for people with disabilities, social assistance is at $1,200. It is been called legislated poverty. It is not in line with what we've seen around CREB or other basic income measures. And I have to again speak candidly. We see the pathologies of poverty and how we have such a cruel social assistance rate in what we see in the clinics, whether it's in Sound Times or downtown academic hospitals or other parts of the shelter system or encampments, that this is having a incredibly, just incredibly dark disparity that we're seeing when we're talking about, as Louisa spoke to, some of the luxury condos and supply conversations, a total disconnect. So the question we want to get at, how do we better support people with disabilities, whether on ODSP or OW, with this lack of supportive housing? And how do we fix this?
Okay, I'll jump
All
in.
right, all right. Over to you, Luisa.
Sure. So going back to this idea that housing affordability is relational, right? Housing affordability relies on income, right? And the cost of everything, but people is spending the different, fulfilling the different needs that they have, right? So clearly there's more need for income. That's one part of it. And the other angle of it is the commodifying housing and expanding opportunities for nonprofit options, right? Like there's little less to do, right? Like either you provide people who are on fixed income with the proper income to actually fulfill their needs and cover expenses, or housing has to be decommodified, right? There's no other way around it.
Very spot on solution. Luisa again wrote income as the root cause of what we're seeing in terms of both the health and housing aspects. Does anyone else want to try to solve this knot around supportive housing or the serious disconnect, as Luisa has spoken to?
I don't know if I'll answer this properly, but I'll give you an example. I used to sit on the Toronto Community Housing Design Review panel, and so it's sitting and reviewing all the master plans and site plans, etc., for all the revite sites in the city. And once you get a rendering of a building, and it's quite detailed, you see architectural drawings and renderings, etc. And one question that used to always come up, both from the panel and from the community, is there no minimum standard to ensure that some of these units, whether it's stacked towns or in sometimes cases other low-rise buildings, is there no standard to ensure that these units are accessible? And the answer was always no. And so for me, I think folks see some of these minimum standards things and regulation pieces as like barriers to getting things done, instead of like the key factors that we know that we need in order to ensure that the housing that we are producing now is dynamic and can suit a range of folks' needs. I think on the supportive housing piece, perhaps a little bit outside of my lane, but I think ensuring that there is again, for the public investment that we're making in things like public housing, that we ensure that that can serve a range of folks, including those that need affordable, accessible, and supportive housing. I think that kind of step and regulation, is important.
Yeah, and just is there a rapid response from Steve or Kate? Just one thought to that, and there's a technical question for Paul. So I just want to have a chance for us to get in right before 11:25. Now you see my time management. You see that I'm all over it now. But Steve and Kate, if it's all right, we can go back to Paul. But just wanted to build on one point that Paul put in. But I throw it to you two, unless you're okay on this.
One thing I would like to say is that I spent 1.5 years as a housing worker at a large downtown drop-in. My job was to find people housing. In 1.5 years, I housed 6 people. 6 in 1.5 years.
Yeah. Yeah. No, it's incredibly hard work, but I know that less than one person a month is not the clip that you wanted, Steve. Kate, is there anything on the supportive housing piece?
I think the only thing I would like to say really, and maybe to end on a positive note, is what I found quite exciting about it, at least my involvement in the initiatives that I'm doing, is this cross-sectoral collaboration, which I think is really what's going to see results. And just following up on the question about other justice center models, independent evaluations of those other justice centers concluded that is important. Local, coordinated, multi-agency responses working together are actually what is going to make a difference, I think, in achieving these long-term reductions. In my world, what we're looking for is reductions of crime. And so I'm excited about that multi-sectoral collaboration that's happening at least in my little world.
Yeah, and Kate, I don't want to pull the optimism, but I think to what Steve has spoken to and the incredibly hard work that's had to happen in a place with no options for people in terms of 6 folks over close to 18 months. And Paul, I think to your point about the public investment, I think it's also important, that and you've all spoken to this, of how both inequitable and inefficient the status quo is. I think we look at the latest numbers around a month in the sheltering system has now ballooned to close to $6,800 a month, if not more. And the supportive housing options, that Steve and others have spoken to, is $2,500 to $3,000 a month. I mean, if you are not in this for human rights or human dignity, just from the economic perspective, it is also incredibly, it is inane and it is cruel in terms of what is happening. Paul, I wanted, there was a fan question for you in terms of where it was around the technical solution that you wanted to speak to in terms of wanting an example, and then potentially, from the person who posed the question, how you might together get political support to mark funds of tax revenue. But this to you about any example around the technical solutions you raised in your earlier comment.
I can't remember what I meant in that specific context, but perhaps I'll give another example. I think, it's important. So, you know, the discourse around human right, like housing as a human right, we're often having that in like a very like universalist, uh, uh, frame. And so I think it's important that, we push for distinction-based targets, disaggregate that data and look at the inequities there. And I think that once we have that data, like, for us, there's a commitment to the collection of data, the utilization of data, and the governance of that data. I think it puts a demand on the housing secretariat and city council to respond to those housing inequities that end up being health inequities, of which, we've spoken about at length a little earlier. And then I think, it's not easy. The city then has to work to identify the funds based upon those targets that are clearly designed to address those inequities. You know, the city often like puts together strategies that are like entirely unfunded, and go nowhere over the course of many years. I think, in order for us to really, recognize people's humanities and human rights, etc., we need those distinction-based targets. We need the targeted and focused investments. Whether it's a percentage of tax revenue, I'll leave to the experts like Louisa. But from our perspective, I think it's critical that we have that focused attention, and the mechanisms to support the analysis and accountability.
Thank you, Paul. And, I think as we're coming up on time, I just wanted to really just reiterate what I think has been, an incredibly unique and powerful panel, given the different intersections that we've spoken about. And I think to me, what has been so clear from your remarks and the conversation is this is really about accountability from every level of government, from the private sector to public sector, and those of us working in the healthcare and housing sectors. The investments, the shift to move upstream, to have this health equity focus at the outset, to be thinking differently about our public investments, as Steve and Louisa have spoken to, and Paul and Kate. And I think really this element that Louisa helped framed, some of this, the real dire aspect we're in around life and death, and Paul pulling this together again around the human condition, and that we cannot, in closing the panel, be lost in terms of the humanity that we are missing and that we have lost. And I think really to speak to those of us, and many of us, and all of us on the panel, but many of us in the room, of the huge amount of loss we've experienced and grief over the last 2 to 3 years. I'd be remiss to not speak to that. Many of us have seen people die, people continue to be neglected from the care that they deserve throughout a pandemic. And I know we carry all of that with us in this work. And really, again, about how important this is. And my gratitude to you, the panelists, who are doing all this work where there isn't even a system in place. And I think we've seen this with Kate's examples and others of trying to create a more humane system around people, and at least a more constructive option for people. So I got us at 11:31 after starting 5.5 minutes late. So I hope there's, some appreciation around from the hosts as we got this together, and all that kudos should go to you. So thank you so much for having the conversation together, and looking forward to staying connected in the work going forward. Thanks
Thank you
all.
all.
Thank you.